Okay, so a very good evening to everyone. Thank you for joining our webinar. Again, for those who just joined, we are actually from Eternal Clinic and Wellness, and I really extend a warm welcome to all of y'all who are joining us tonight. So the topic today is about the modern male epidemic no one talks about. Most people are shy, or being from the Asian side of the world, we are a little bit taboo about this topic. My name is Dr. Stephanie N. Sada, and tonight I will serve as the moderator. Without further ado, I would like to begin to formally introduce the host of tonight's event, which is Eternal Clinic and Wellness, where a little introduction about us is that we are actually integrative medical center where we dedicate our time and specialty in general practice, integrative, regenerative, and preventive healthcare. So we actually combine evidence-based medicine with modern diagnostic and restorative therapies. So this clinic is not only a GP clinic. However, we focus on understanding health from the cellular and metabolic level. So what our goal is, what we want is to empower clients, our patients, to restore balance rather than just treating symptoms. So Eternal Clinic and Wellness, here we strive to increase public awareness and to promote long-term well-being. So for tonight, we have our very first speaker, Mr. Yah Wen. Now, Mr. Yah Wen is a fat loss and body composition specialist. He is also the director and master coach of Leow Fitness. So Mr. Ho brings about 2 decades of technical and coaching experience, and he has successfully guided numerous individuals in achieving sustainable results, where he actually concentrates on fat loss, improved vitality, and lifestyle transformation. Ladies and gentlemen, please welcome Mr. Yah Wen.
Thank you very much, Dr. Stephanie. And it's great to be invited again for this month's health talk. And as some of you may have known, November is actually men's health, right? We celebrate men's health. And in this month, it is a timely reminder that real strength starts with awareness. Right? This month puts the spotlight on issues many men may ignore. For example, heart health, hormones, mental well-being, sleep, and also preventive screening, right? Taking care of your health isn't a weakness, right? It is actually you as a person showing leadership, responsibility, and self-respect. So I'm gonna start share my screen if you bear with me for a while, where I'm gonna talk about the topic I'm gonna share for the start of this session is called Unleashing Your Inner Macho, right? How can lifestyle and nutrition changes will improve your vitality, your energy, and your sex drive. Okay, so for that, let me I don't need to reintroduce myself again. I've done it in the last sharing, but very quickly, as what Dr. Stephanie mentioned, I have more than 2 decades of experience in technical precision applied to about 10 years of health and fitness coaching. I have my certification from FIT Malaysia as well as Australian Strength Performance as a body composition and fat loss specialist. I established this company called Leow Fitness, which is a mostly online-based coaching service and education academy where I teach and coach hundreds of Malaysians, no matter you're a busy executive or stay-at-home moms, basically any adult, right? And I'm also a book author, magazine and newspaper guest columnist, written articles for Caliber as well as Star newspaper. I've also been invited as a radio station guest in this station called IFM. Okay, now that's the boring part. Let's talk about man's hormone. All right, and when we talk about man's hormone, We obviously are talking about testosterone. Now, it is a fact, and this is fact. We have to accept it. As the man grows older, all right, from the 20s when they are adult down to their 60s, 70s, and eventually 80s, the testosterone level will decline. Will decline. It is given. The peak of testosterone production happens when you're a young adult in your 20s, right? That's where you have all your vitality, your libido is very high, you have all the focus energy, right? But as you grow older, especially after age of 40 and beyond, your testosterone level will definitely go lower. Okay, you have to accept that. But if you look at the rate of testosterone over time, now this is data, all right? The average testosterone level over time, if you look at from the late 90s, okay, all the way to in this chart is about 2015, 2016, the average rate of testosterone over time after adjusting for age is actually declining. It's actually declining from decades after decades. Now, if you look at the data by country, countries like Uzbekistan, Cameroon, Mongolia, all right, and Nigeria, these guys have the highest testosterone levels in the world. However, if you look at on the picture on the right, the countries with the lowest testosterone worldwide are countries, for example, like Venezuela, Kuwait, Chile, Estonia. And you can see Malaysia is somewhere in the middle. Average testosterone level is about 464 nanograms per deciliter. All right, so it's very interesting to see the distribution of average testosterone spread across age, across the years, and also according to different countries. Now, I'm going to talk about testosterone decline, right? Now, as I mentioned in the first slide, as you grow older, your testosterone levels will drop about 1 to 2% every year after the age of 30. Okay, now this is physiology. This is standard, all right? Now, by the age when you are about your 70s, your testosterone level can actually reduce by 30 to 50% versus the time when you are in your 20s. Now, there are also modern trend factors. The testosterone, average testosterone, as I showed in the graph earlier, today is actually much lower versus a few decades ago. Now, this is what my teacher told me, right? He said most men, they have the testosterone levels now in their 30s or 40s, the levels of their grandfathers, right? Their grandfathers in their 70s or 80s have much higher testosterone than they have in their 40s or 30s. Now, a drop of about 1% of average testosterone rate per year happens from 1987 all the way to 2004. Now, that is 2004. Today, we are 2025. We are almost 2026 already, adjusted for age. So, the drop is actually declining year over year. Now, when we have a low testosterone, what is the effect a man can experience? Now, pay attention because this may be happening to you right now, or if you're a lady, it may be happening to your husband or some man that you know that is close to you. The first one is physical changes when someone has a low T. Firstly, you know that testosterone is the hormone that is anabolic. Anabolic means that it helps to maintain and build muscle mass. When a guy has low T, low testosterone, he will experience loss of muscle mass. Okay, that's given. And because of that, a low T will also increase fat storage. A guy, a man, if his body starts to accumulate a lot of fat storage, that is also a sign of low testosterone. And testosterone, not just about muscles, all right? It also helps with maintaining your bone mineral density. That means how strong your bones are. So if you have a low testosterone in your body, the mineral density of your bones could be reduced and you may be suffering from risk of fracture when you're having a fall or or an accident or things like that, right? Now, this thing called man boobs, as in you can see from this picture on the top right, right? Now, I am very sure you have seen this a guy with man boobs before, right? I've seen it so many times, especially when we go to the swimming pool and things like that, right? So you may observe that, hey, nowadays, modern men, more and more of them are having these man boobs, or the clinical term, we call it gynecomastia. All right, the doctor will tell you you have gynecomastia. That means the shape of your chest is not a chest, it's actually breast. A man having breasts. That's not right. Now, from my practice, when I observe a guy, a client, a man client, right? And I will look at, okay, whether I will do some estimation, but whether this person has a high or low T by just looking at their skin fold measurements. Now, two places on their body will indicate and is correlated to low testosterone effect. Number one is the skin fold measurements at their triceps, okay? Triceps just under their arms. A guy's triceps should be having very thin skin fold. Very, very thin skin fold. In fact, it should be very, very, very thin. Okay. If you can have a skin fold measurement of about like 4 to 6 millimeter, then you are very good. But a lot of guys, you can actually pull a lot of skin at their triceps level. Another place is the chest. Okay. It's about like 1 or 2 inches away from the nipple. If there's a lot of skin that can be pulled out, that means this guy has a problem of testosterone. Okay, so this is what I do in my practice when I assess a client to know whether he needs to lose a lot of fat, increase his testosterone via lifestyle changes and exercise and nutrition. Okay, now that's physical. I'm sure there are more physical effects of someone having low testosterone. Now, how about the mental and emotional side of things? When a person is having low testosterone, he may be suffering from chronic fatigue throughout the day, like always feeling tired, right? Before the time is even 2 or 3 p.m., is already feeling sleepy, tired, low motivation, low drive, low energy. Okay, so that is also a sign of low testosterone. And he may be suffering from depression, always having negative thoughts, all right, always thinking about how the world is against him and things like that. Things like that. Another sign of a mental and emotional effect of low T is poor cognitive function. Like the person just cannot think properly, or when he's driving, right, supposed to turn left, but for some reason he goes straight, like he cannot focus. All right, this is also a sign of low testosterone. And last but not least, low testosterone has been associated and correlated with low confidence. You can actually tell very clear differences. A guy with very high testosterone, he is very confident. He doesn't need to be a violent person. Any stress that comes to him, he will go through it calmly, and he will just smile and can just go through any challenges that he faces. That's a guy, high testosterone guy. But on the other hand, if someone is having low T, right, you'll panic very fast and you'll start to cry. And I always tell this joke to my clients, right? When someone is a low testosterone, he always worry about others' opinion of him. Like he go try on a new pair of jeans and he comes out and he asks his buddies, "Hey, do I look fat in these jeans?" Things like that, right? Okay, so this is some of the effects of low testosterone effect. Now, last is the sexual health, right? Now, if you have low T, you will also have low libido, drop in sperm production, and erectile dysfunction. Now, these are issues that nowadays men usually are too shy to talk about. They don't talk about it, right? And I'm here telling you, guys, if you're having this problem, you are not alone. And help is always there. That's why I'm very glad that I met places like Eternal Clinic and Wellness, right? You can always talk to the doctor. You can do it discreetly. Your information, nothing is going to be shared to other people, right? The doctors at the center is here to help you to overcome all these problems, and there is always a solution. Later, you'll hear from Dr. Leow on what are the ways and treatments that can help you with this. Now, what are the causes of low testosterone actually? First and foremost, fat, obesity. If you have a lot of excessive body fat, right, these excessive fat cells actually cause an increase in estrogen. Estrogen is a woman's hormone. Now, both men and women have estrogen, just like women, they do also have testosterone, just very much low level. Guys, you also have estrogen, just lower level. But if you have excessive fat cells, a process called aromatization will happen. And aromatization is a process where your testosterone is converted into estrogen. We don't want that to happen. And if you're carrying a lot of excessive fat cells, this aromatization process will happen. So lose some fat. Secondly, is xenoestrogen. The word xeno means alien. Estrogen is the women's hormone. So xenoestrogens means they are chemicals that is from outside that enters your body, and the form of the chemicals mimics estrogen. It looks kind of like estrogen, so your body treats it like estrogen. Now, exposure to this kind of like xenoestrogens. Now, what are these? For example, pollution, right? Air pollution, water pollution, all these chemicals from the spray and all this cheap stuff, right? All these are xenoestrogens. Perfumes are also very high in xenoestrogens, especially those very cheap perfumes that you can buy from, the Pasar Malam or whatever, right? So those are actually very high in xenoestrogens. The thing that make your car smell like a brand new car smell thing, that is actually quite high in xenoestrogens, in my opinion. So I will take that away from the car. Secondly is, of course, BPA. So if you are still drinking hot beverage or tapao from outside using plastic, all right, plastic containers and things like that, I would advise you against doing so, because you are not only exposing your body to microplastics, but potentially all these xenoestrogens. Now, I have many clients who stop using all these, plastic packagings and trying to stay away from all these xenoestrogens, and they do see an improvement in terms of their health, testosterone level, vitality, strength, focus, drive, and sex life, right? Now, all these things, all this exposure to xenoestrogens will cause a low T effect, especially if your detox and digestive process is poor. Last month, we talked about digestion, right? So you can visit Eternal's YouTube page to rewatch the talk again. But if you are currently having poor digestion, your body cannot effectively detox or take out all these excessive xenoestrogens and also natural estrogens, then you will have a low T effect. Now, the third one is a very important one, and I am very, very sure every person in this room in Malaysia is suffering from it. This is chronic stress. Okay, when I talk about stress, it's not just about mental stress or emotional stress. The stress can come from chronic low-grade stress. Low-grade stress, right? It's stress that, for example, we talked about food intolerance last week. If you are keeping your body exposed to food that your gut cannot tolerate over a long period of time, that is low-grade low-grade inflammation, which increases the stress. So that's also contributing to stress, right? Now, if you are suffering from chronic stress all the time, it elevates a hormone called cortisol. Cortisol is known as the hormone of stress. So elevated cortisol will reduce testosterone levels naturally because of a process called the pregnenolone steal pathway. Wow, coach, so what is this? Never mind, let me show you. Now, pregnenolone, you can consider it as the mother molecule of your sex hormone. Okay, every day your body produces a limited amount of pregnenolone. Okay, it is like the bahan asas for your sex hormone. Pregnenolone is used either to produce progesterone or DHEA. And from progesterone, it will produce cortisol, the hormone of stress. And from DHEA, it either produces testosterone or estrogen. If you're a guy, more testosterone is produced. If you're a lady, more estrogen is produced. Now, due to the limited amount of pregnenolone your body can produce every day, your body has to decide, hey, I need to produce more cortisol, stress hormone, or more testosterone. Now, think about this situation. Let's say today you are in the caveman time, right? And you come out from the cave and you're supposed to hunt food for your family back in the cave. However, suddenly out from the bushes, a tiger suddenly jump out and wants to attack you. At that moment, your body is in a very stressful state because it needs the cortisol level, cortisol hormone to have a sudden increase of energy. Your heart rate pumps faster. You can run faster. You are stronger faster just for that momentary time. So you can either run away from the tiger or fight against it. We call it the fight or flight hormone, cortisol, right? At that moment, do you think your body still think about, hey, I need to maintain my testosterone so that I can, have, help in the reproduction process and all that? No, right? Your body don't care about reproduction anymore. It's about you surviving. So back to modern day. Of course, we don't hunt tigers nowadays, right? All the tigers are in zoo. Thank God. So, but people who are working in the office, people who are dealing with a very stressful life every day, your body will still treat it as a stress, just like being attacked by a tiger. So every day your body have to decide, hey, I need to produce more cortisol or testosterone. And if you are very stressed, more cortisol is produced, testosterone will drop. Okay, so it's an either or situation. You can't just like top up pregnenolone. Okay, it doesn't happen. So how do you help your body to increase or put the macho back in you again to increase your testosterone? Now, here are some strategies which I personally use for my clients. Number one, you must always fix the nutrition, your food. Number one, if you're not doing so, please minimize, if you cannot avoid, but minimize all these ultra processed food and drinks. Ultra processed food and drinks. Now, today, we still have a lot of people still don't understand what is ultra processed food, what is natural whole food, right? I make it very simple, right? If the food you're eating, let's say it's a meat, if that meat don't used to have eyes, legs, tails, never fly before, never swim before, probably it's not natural whole food. If the plants you eat is not green, does not grow from the bushes, doesn't grow from the tree, then it's not really vegetable. So think about it. Have you ever seen a waterfall with cola flowing down? Right? Have you ever seen a tree growing donuts? No, right? So these are things that you should minimize. Not totally, I mean, if you want to cut off, by all means, go ahead, right? But if you can minimize, all power to you. Now, choose foods that is high in zinc because zinc has been shown to help reduce the process of aromatization. And zinc is also very good in helping your digestion, right? In fact, zinc is, for me, is known as the great organizer in your body. So food high in zinc are such as oyster, red meat, Brazilian nuts. Now you can ask ChatGPT, list down all the foods that is high in zinc, then consume them regularly if you feel that you have low T. Now consume healthy natural fats such as olive oil, nuts, coconut oil. Why? Remember that mother molecule pregnenolone, that comes from healthy natural fat. Okay? That comes from healthy natural fat. In fact, pregnenolone comes from cholesterol. Okay, so if your cholesterol is way too low, it's also not a good idea. Now, cruciferous vegetables are vegetables that has compound of sulfur, such as broccoli, kale, cabbage, kailan, and all that. Because why? These vegetables are actually very good to help bring out all the excessive estrogens from your body in the liver. All right, liver, you got phase 1, 2. So cruciferous vegetable actually contains compounds such as DIM, I3C, which is very good in detoxing all this excessive estrogen from your body. Lastly, we have garlic. Garlic contains this compound called allicin, which has been shown to support testosterone production. Now, that's nutrition. We cannot talk about health without talking about exercise. You must perform exercise. If you currently have excessive body fat, please exercise. Now, for my strategy, okay, the way I put programs for my client is that I will give them a fat loss type of resistance training. Resistance training means pushing weights. All right. So it has to be high volume, multiple reps. You don't have to carry very heavy, just high volume with very low rest time if your body permits. All right. Now, for guys, if you enter the gym and you're doing exercise, please don't skip leg days. Don't every day train your biceps. Okay. You must not skip leg days. In fact, I currently train my legs 3 times a week. All right. Because why I'm in my 40s, right? I want to maintain my testosterone level. All right. So don't skip leg days. The best exercise is actually to increase, leg exercise is the best exercise to increase testosterone and also the growth hormone. All right. Now, recovery. Recovery is all about how your body rests. How do you put your body to rest, right? So recovery, sleep is king. Remember, I say that stress steals, pregnenolone away to make cortisol instead of testosterone. So the way to lower stress is sleep. Sleep is non-negotiable. Sleep is the best way to lower stress. If you have trouble trying to sleep, then you need to have a very good sleep hygiene protocol, maybe going to bed earlier, making sure your room is comfortable and things like that. And if you are suffering from insomnia, really hard to go to sleep, then you can actually use things like adaptogens or supplements as needed and advised by doctor, right? Such as magnesium L-threonate is one of the best supplement to help you to relax and calm down and just literally shut down your brain to sleep. Ashwagandha has been shown not just to help you to calm down, relax, and sleep better, but ashwagandha has been studied to also help boost testosterone level. So there are many botanicals and minerals and vitamins that can help you. Now, this one I will leave it to eternal, and so Dr. Liang may talk about it later to help you with all this, right? And last but not least, please avoid exposure to all these xenoestrogens, right? All these extra perfume and sprays and cheap quality paints and things like that. Don't ever go and tapao in plastic again. Bring your own stainless steel or glass container, right, to go and pack your food from outside. Then you're doing yourself a very good service to take care of your testosterone level, especially if you are already in your 40s. Now, last but not least, fixing testosterone, actually not fixing, right? As I showed, your testosterone level will go down over time. However, you can always slow it down, right? You can always slow it down by doing what I just tell you. It's very basic, right? Eat right, exercise, making sure that you have enough recovery by sleep and all that, right? Once you get the basics right, then I'm very sure you will bring back the man in you. Okay, so that's all I want to share. And now I pass the time over to Dr. Liao.
Thank you, Mr. Ho, for a very wonderful sharing. By the way, Mr. Ho may look young for his age, but you will be surprised that actually, before we move on to Dr. Liao, I would just like to tell a little bit of, fun fact. Okay, so did you know that testosterone is actually an indicator to a heart attack? Most people will have erectile dysfunction, most men will have erectile dysfunction or low libido 3 to 5 years before actually getting a heart attack. So there's this joke. One of my patients actually told me this joke. So I'm just quoting. So men say they're fine until they're not. And then suddenly Google will become their doctor, and they will only see an actual doctor when Google tells them they have 24 hours to live. So, ladies and gentlemen, it is now my privilege to introduce Dr. Liao Hong Ti, who is a family medicine specialist, functional and regenerative medicine practitioner. Now, Dr. Liao has had an extensive clinical experience in men's health, metabolic disorders, hormonal evaluation, and evidence-based preventive medicine. So without further delay, please join me in welcoming Dr. Liao Hong Ti to begin the session. Dr. Liao?
I need to unmute. Okay, I'm audible. Now I'm audible, right? Yeah, so my slide
Yes,
also can
can
be
hear
seen.
you, Dr. Liao.
My slide also can be seen now, right? Yes. Okay, all right. So a very good evening to everyone. My name is Hong Ti. I'm a family physician. First of all, I would like to thank Eternal for inviting me to share about this topic. So I think a brief introduction. I think as like Dr. Stephanie said, I'm a family physician. Actually, I'm still working with a government. I'm working in a government clinics, clinic kesehatan in Penang, under Ministry of Health of Malaysia. So today is more of sharing of my own. I'm not representing a Ministry of Health itself. So don't quote Ministry of Health later. They say Dr. Leow says so. So of course, this is partly that I go through with some patients, that my experience that I have with this kind of what we call a testosterone deficiency syndrome. So I think we try to make the sessions a bit, relax, yeah, it's not so tense, it's not listening to lecture or whatever. It's you all can put out a reaction, whatever. Then later, if you have questions, you all can ask about it. We try to like make it a very Malaysian style, sometimes Sempoy kind of style, I think that's the things that we can get the most of the knowledge, because sometimes lectures so long, you don't even can get back the informations. We just hopefully we can get 1 or 2 points go back, then I think it's good enough. I think the information is delivered. Huh? So I'm going to talking about like this testosterone deficiency syndrome. Of course, I'm talking according to the guidelines. What guidelines have shown, what the international and also the national guideline has shown what we should do. But of course, I will also add on my own practice preference that may a bit different from guideline. It's not I don't agree, but I think I think I opt for like more individualization, because like I think everyone is a bit different. Guidelines always is a guidelines, right? So I think everyone is different, right, from experience and what experience I have so far. Okay, so let's start. Yeah, before that, I acknowledge it's actually one of my friends actually prepared this, not prepared, he prepared this lecture, this PowerPoint solution, and add on some amendment to make the presentation today. So he is Dr. Lee, who is a men's health specialty training lah. So he's a good friend of me. So and thank him for letting me to use part of his lecture notes lah. So I think like this is a things that once we call hypogonadism, in medical we call hypogonadism. Of course, I think in the layman term they will call it like male menopause. Once we say it's man no pause, they say man no pause, So they say man is from 9 years old to 90 years old, it's man totally no pause. But actually man actually has a pause, that where there's the testosterone's coming down, right? It's just like a woman. Women also have this menopause, right? So, but I mean, women have something very objective to tell that they have menopause when they have no menses. But men, they silently, the testosterone drops, then you only notice, very subtle notice, so no one talk about it. They thought it's normal, part of aging or whatever. So that's why this topic that men's often not talk about. And in fact, I think in clinics, I think seeing men is much easier, because men's when you ask him, are you okay? Most of the time they'll say okay. Then you can go for next. But woman, you tell them your blood test very good, everything okay, you're looking good, They say, yes, doctor, I know, I'm okay, but they'll tell you their problem also, right? So I think that's the difference. I think by nature, it's the kind men's usually they are a bit more they are not spoken out, they keep like Dr. Stephanie said the last minute, you're gonna lie 24 hours, then only they will go to seek to see the doctors. So there's a whole about this hypogonadism, or we meant male menopause, it is said. All right. So I'm going to share about like what is the role of testosterone, the clinical symptoms, epidemiologies, and what is comorbidities that is associated with it, and who to test for testosterone, when to treat it, and what is available to treat, and what is the risk of treating it with testosterone. So I think the role of testosterone actually is across the whole body. So testosterone itself is not just for sex, and 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 one thing is that's not very correct is they say it's male sex hormone. Actually, it's not. It's just that predominantly it is in male, but female also you will have some testosterone. You also need some testosterone in order to drive a life, right? So basically, it's a hormone that keep you have the drives lah. So it help you the libido, like just now like Coach Ho say, help you with the memories, even muscles, cut down fats, your bone health, everything, right? So, and this is like usually like young men, usually they will look like that, right? Because they are full of testosterone, right? Then when you get mature, you get older, you grow older, then you started to have this kind of appearance, right? So they said, I'm not eating much, yeah, I'm also appear be like that. So partly, of course, is testosterone, and partly, of course, your lifestyle, these kind of things, right? So next, I think these popular symptoms, I think Coach Show have elucidated very, very well. So we divided it into like emotional symptoms, physical symptoms, and also the sexual symptoms. So I'm going to show you like how like when from you have mild reduced level to the very severe kind of like reduction level of testosterone. So it was started with like something but very unspecific that you may think that you have like you don't have sex drive, you don't have vitality, because you work for whole day already, you think that, okay lah, of course, I'm so tired, of course, I don't think of sex, these kind of things. So, and you say fatigue because I work for whole day or because I'm old age, then after that, when the level get lower, then you become more moody, starting cannot to sleep. Then they also get flushes. Men also get flushes. Okay, so starting of this kind of symptoms, then only like erectile dysfunctions. So when it goes up to the level, like Coach Ho say that you have reduced muscle mass, visceral body fats is increasing, you are no, you're going to actually quite a severe kind of deficiency already. And if you go beyond that, like maybe this gets smaller, atrophy means that it gets getting smaller, then your bones started to be very brittle, and some will start to lose, the facial hair, your axillary hair, and even your pubic hair. So that is the degree that you can gauge. So I think it serves as a skills for you all. So I'm not sure where if you are having this problem. So maybe you want to like yeah come to see doctors to get it sorted out lah. Huh? So, and there's prevalence of testosterone deficiency syndrome, and we can see this in Asia country. So, of course, different age group or different biomarkers they use and different cutoff they use, they have different percentage. So, let's just see like in Malaysia itself, you all can see the cursor, I'm not quite sure. Okay, you see the fourth one, Malaysia is more than 40s, more than 40s, they take account of 11. So, more than 40s will be like me myself, Coach Ho also like 40s in the 40s, like myself. So out of us, like five of us, five of the similar of us, we will have almost one is having testosterone deficiency syndrome. Not to mention if you are a bit older, like 50, you can get up to 30%, 40%. And they said virtually if you get up to 80s, I think most likely is more than half of slightly more than that. I think 60 or 70% they will have this deficiency, testosterone deficient. Okay, because our body already no longer produce it so much, right? So this one I think Coach Ho has shown before, our testosterone level start to decline by the age of 40s, right? So but women's hormones actually they decline even faster. So actually women's age faster than the men. Women started to lose hormone at maybe at the 30s, 30s, late 20s or early 30s. Men usually late 30s and early 40s. So that is how it is. So and we can see a lot of this kind of men that have this low testosterone, they are associated with this diabetes, metabolic syndrome, which I'll talk about later, and cardiovascular disease like heart attack, stroke, diabetic also, and also CKD is chronic kidney disease, and also cancers. Okay. So I think just now I have decided the just now Coach Show has shown you what's the causes of the low testosterone, low T, of course, age is one because reduced production. I think that's very easily understandable. But of course, why over the years, I think Kosho has seen like our society, we have a lower means of testosterone as compared to our previous generation. So basically because of the stress. I think stress is one of the very, very important structure. Nowadays, I can see a very young patients that come in with a very low testosterone, you know. So the like Coach Ho said, it's because of what we call this pregnenolone steal or corticosteal, or you want to call it progesterone scale, whatever name you name it, because basically our body, is cortisol is our survival hormones. You need cortisol, you need to survive first. Then only you can do entertainment. So we put it like one is survival, one is entertainment. Of course, when your body is always in survival mode, the body will change it towards to this survival mode. They won't go to entertaining. So when you're in great stress, you will not able to have sex. So I think in order to gauge someone that you're healthy or not, for men, you will ask for their sexual performance. If this man can perform sex very well, most likely he's quite okay. Most likely he's quite healthy. And for a woman, they are fertile, meaning how do you gauge fertile? It's like they have regular cycles, these kind of things. Most of the time, they are quite healthy, right? So that is the things that I want to stress. I think just now Coach Ho had brought up, and this is just a more complex kind of things. That the things, but it's almost the same. Is saying the similar things. So it's like our body turn into the stress fighting mode rather than building our sex hormone mode, right? So that is this what we call pregnenolone steal or cortisol steal. So, and of course, low T is always associated with a lot of things like metabolic syndrome, where I explain in a short while, and hyperinsulinemia. Hyperinsulinemia is something that, before diabetes, you turn diabetes, you will have a chronic stage of increase of insulin because our body is trying to push the sugar into our body, our cells, so that they will increase the insulin, right? So until a point you reach a break point, then our sugar will spike. Okay, so at that time, insulin start to come down. That's why, after that, you need to use the injection of insulin in order for them to push the sugar inside the cells. Then, of course, it's associated with diabetes, heart disease, hypertension, the central obesity, thrombosis is the blood clots, and also C-reactive protein means that the inflammations, there's a lot of inflammation if means that when C-reactive protein is high, means that the body have inflammation, and of course the deranged lipid profile. Okay, so and this is a schematic diagram of I tell you, like when you have low testosterone and you have low SHBG. SHBG is one of the binding proteins of testosterone. So you are associated with this metabolic syndrome. Metabolic syndrome is basically is like our three highs, our high BP, our high sugar, and also our high triglyceride, which is the cholesterol, the bad oil, right? When you check the blood profile, the doctor will tell you this is a bad oil, triglyceride. So, and also you have this reduced the good cholesterol, the HDL, and also the central abdominal adiposity. So if you have these three of that, then you can consider as a metabolic syndrome. So when you have metabolic syndrome, you're more prone to get diabetes, and you're more prone to get chronic heart disease, meaning is the heart got blockage, right? And also, of course, the heart can be blocked. Surely the brain's vessels also can be blocked. The stroke also will be higher. Okay. Then next, so who to test, So screen for this testosterone in patients in symptomatic. This is what guideline told us, right? But of course, you can see, actually men's above 40, I would say a lot of times you will have a bit of fatigue, So I would advise like if you are 40s and above, you can just screen for it lah. Yeah, if you are like you have fatigue, decreased motivation, reduced libido, so this is the kind of symptoms that you wanted to screen, right? So and when you are like you find that you cannot accumulate you find that you cannot lose the fat cell, your fat cell just keep on accumulating. That's because the testosterone is really low. So it's a high time to screen it, right? So the diagnosis is biochemical. We take the blood test, to check for testosterone level. Then, of course, the sign and symptoms, right? So the guidelines say that we need to have combination of these both in order to have a diagnosis of this testosterone deficiency syndrome. Okay. So how are we going to measure the testosterone? Of course, in lab, there are many types of measurements. The most commonly used is total. Then we have this free, because free testosterone is the one that's circulating, they're going to exert, their effect. So we'll prefer to have free, but of course, free one is not free. It's very expensive, you know. So usually we'll do some like proxy kind of thing. We use this free androgen index, you know. We use a proxy kind of marker to tell that this is whether the free testosterone is high or low. Okay. So that is the thing. I say if you are interested, you know, then when you see us, then we can explain further about that, right? So, and of course, guidelines say that we use the morning testosterone. Okay, when you take blood test, we take morning because morning is the highest testosterone that we can achieve. Then, and generally, you know, they take about 300 to 1000 as normal. You see, the range is very huge, you know, 300 to 1000 or nanogram per deciliter. But if you think in nanomole per liter, I think most Malaysian lab they use nanomole per liter is about 10 to 35 like that, right? So confirmations is a repeat morning total testosterone. Okay, you need to repeat it. So you have two samples, or you want to repeat it in the free form or what we call bioavailable form in order to confirm your diagnosis. So I think I want to share this. I think this is my opinion about this normal. I think Coach Ho has shared it the last slide of him, but I think he didn't elaborate more. So maybe it's for me to elaborate a bit more, which I think uh, I share the same opinion as Coach Ho. You know, so they say wise men think alike. But maybe I'm not quite sure we are wise men or we are fools. But of course, I will tell you why I think so. What is normal doesn't mean that it's optimal. So if you have ever learned mathematics before, I think in our I think secondary school, right, I think you learn about normal curve distribution. You know, like when they call normal, it mean that you are fall within this 95%. So when you fall out 2.5% lower than the usual, so you'll call it abnormally low. Then if you fall above 2.5% of average, 2.5% of the normal, so-called, so you will consider as abnormally high, so which is abnormal. So the both side of 2.5% is abnormal. So anything between 2.5% and 97.5% is considered normal. So this is what our lab give us. Also, I give an analogy of like I think everyone we go to school before. I think we do exam, we take exam. So right, if you take like from exam can be from 0 marks to 100 marks, right? So if it takes like normal, meaning that anything if you get 2.5 above up to 97.5 not up to 97 you are considered normal, right? You are considered normal. But I think deep inside our heart we will know a student that score 50 marks and a student that score 90 marks is totally different. And not to mention that the student that score maybe a mere 10 marks as compared to 90 marks is totally different. So that is the things I think like, you know, we shouldn't be very happy about normal. I think we need to strive for optimal kind of thing because that an optimal level of everyone can be very different. So I think that is the time that's why you need to talk to your healthcare professional to get optimal rather than you are happy with normal because the normal for you may be not the optimal for you. Okay, so that is the one that I wanted to stress. But of course, I think in our conventional medicine, I think they are they don't take like this quite uh quite what to say quite seriously. I would say they say you're normal, then they will say okay you're normal, then you're okay. So that's the thing that I want to say, right? So this is important. I think for me this is my but of course this is my own opinion, right? But of course I think this I give you the analogy of like a student. I hope that you all can understand. So that's how I talk to my patient, right? So and when to treat, you know. So of course they said when your testosterone level is down less than 230, you have symptoms and we treat it. And if you fall in between 230 to 350, you know, you need further assessment and you can try to treat it with testosterone. And if you're above, you know, 350, then replacement is not warranted. So next come the next questions. if you have the symptoms, very, very obvious kind of symptoms like you're fatigue, you lose your mind, you started to lose hair, you started to have gain fat easily, but your your testosterone level is 360. Are you going to treat or not? Right? So for me, I will evaluate the patient, discuss with the patients. I say guideline doesn't warrant treatment, but maybe it's a good try since you have it and you are at the very lower end of your the results, the normal result, very lower end, So I will advise for treatment. But of course, some may not because they strictly follow the guidelines. So I think that is the difference. That's why you need to discuss with a healthcare professional, see what kind of opinion they have it. You can always seek for the second opinion, then you only decide for yourself, right? So of course, testosterone therapy. The next is talk about testosterone therapy. I think that is the things I think Coach Ho have talked about, like how to do diet, how to do exercise. So we are going to try that drug treatment, which is a testosterone therapy, which is the most research. Of course, I think there's some supplements there, which you can explore. But of course, most of the supplements they are not very well studied. So yeah, so I wouldn't mention here, but of course, if you are interested, of course, you always can get to Eternal, to let them know there's some supplements that they can help. But of course, I have to say that is there's no concrete result. But of course, there is no evidence doesn't mean that there is how to say the absent evidence doesn't mean that it doesn't work one because it's just that some of these natural compound, there's no value in studying it. Uh, yeah, because as a company like it's a drug company, you want to make money, you invest something in natural because natural you cannot patent it. You cannot patent it, you cannot make money, right? So that is the behind story of that. But of course, it doesn't mean that it doesn't work, right? So but of course, this one is based on the discussion with your healthcare professional. Okay. Of course, I think this picture show that before testosterone therapy, you are look like that, and after you can look like that. But of course, this one I think is marketing tips lah. You won't be like that lah, right? You still need to do a lot of things, in order to achieve it. It's not just by testosterone therapy. Obviously, it's not lah. So I've got different ways that you can get testosterone, like injection. I think injections is started in 90s, 50s, like that, very, very long history, So, and topical, then you can use cheek buckle or patches. Then previously people use implant, but now seldom people use implant. Then oral, and also oral means that you take medication and also intranasal. So this is how the ways that you can administer testosterone. So, and this is the FDA approved kind of testosterone formulation. So basically, I tell you the previous like the injection, the problem with them is they are very fluctuating kind of testosterone, so it's not so good. And now they have this testosterone antiquinone, which is a name of libido. They have longer acting. You only do injection about 3 to 4 times a year, so they have more steady state. But the problem is like when you injected, you cannot reverse the thing. You need to wait for it to wear off the effects in about 10 weeks time, right? So what I love the most is actually is transdermal. So because transdermal, it mimics our normal physiology. But of course, it also come with some side effects like skin irritation. Of course, when you apply cream, there's a risk. If you don't wash your hand properly, there's a risk that you transfer to your partners or the kids, which is not so good. Then, of course, oral testosterone, to be frank, I never used it before because they say it's very difficult to obtain the normal physiological levels. And of course, it may be cause some liver problem because you need to process through the liver. But of course, I think in the newer one, they are more liver friendly. But of course, taking pills may be a bit more difficult. So that's why I also not using that. And of course, you can use pellet like I show you, but nowadays, I don't see it. People use it quite often lah, in Malaysia itself. So, but if go according to evidence base, they say gel or this transdermal and also the long-acting injectable is the best safety profile. So usually we'll use these two lah most of the time. So of course, expectation from our treatment, of course, apart from like being a sex hormone, so-called the sex hormone, you increase the libido. Of course, there's increased a lot of things, right? The role that we have mentioned, the bone density, lean muscle mass, erythropoiesis, mean that is the how you make the red blood cells, Then your physical activity, your mental clarity, and your mood, and your cognitive abilities. And of course, obviously, at the end of the day, is the quality of your life, you know. So if like I always tell them, you know, if you have a very clean so-called like you eliminate the risk of like everything uh I just say like cholesterol you push it to very low level, right? uh I'm not against statin. I have to tell, I'm not against statin. I think statin is good for protecting our heart, but you push very, very low, obviously you won't have any heart attacks, right? But as I told you, like cholesterol is a precursor for like these hormones. You are depriving the life, you know. You have a longer life, you don't have attacks, but you are not achieving what you want in life. You feel very lousy, very lousy every day, but your life is very long. So I think we need to balance in between these two. I think in life it's about balance. There is no one thing is absolutely good or one thing is absolutely bad, right? So I think you need to discuss your physicians. You talk about that, what you wanted. I think that's very important. So, and a lot of people thinks that, you know, you put up testosterone gel, your erectile dysfunction is just gone away, you know. But unfortunately, this is not the answer for erectile dysfunction. I think that I think like some of us maybe have problems here, right? But I would say, you know, because I think from study itself, it has shown that, you know, we know that erectile dysfunction is multiple factorial. You know, it can be caused of nerve problems, you know, vascular problems, even your psychogenic problem. And hormonal problem is with testosterone lacking is only 6%. So, and 6% of them, you know, so you're most likely, you know, most of the people that using it won't be have some response. The testosterone itself, will improve your sex drive. Yes, that's definitely, you know, improve your vitality, your sex drive. Yes, but of course, erection maybe not, because a lot of this as these were people with low testosterone, they will have this metabolic problem, you know. So when they have metabolic problem, they have vascular problem. So you still need to sort out the vascular problem in order to achieve the erection. So don't think that, oh, okay, you know, I erectile dysfunction. I just tell, you know, I just get the cream. It should get me the erection, but unfortunately, it's not, right? So this is I don't want to create. I want to like illustrate because we see a lot of men, you know, they put very high hope on this testosterone cream, but unfortunately at the end they cannot get the erection, then they started to lose hope. But of course, there's other things that we can do to help it. Huh? So of course, the possible side effects is like, of course, with testosterone, if you too much, then you can cause some oily skin. You know, you have get some blemishes, acne, like, even can get breast enlargement because it's converted to estrogens too much. Then it can get breast enlargement, and you get a smaller testis, because when you apply external kind of testosterone, the body will sense that, oh, you have enough testosterone. They start reduce production. They will start not producing, so your testis will get smaller, right? So, and of course, they say if you have was sleep apnea, right? When you sleep, you get the disruption. You said it will worsen it for a while. So you need to get it treated before you started it. Then, of course, because it increased the blood red cells production, of course, they can cause some increased blood thickness. But most of the time, it won't be very significant to cause thrombosis, to cause the clotting lah. And of course, decrease sperm cell because it our normal body's testosterone is reduced. So if someone that still want to father a child, or someone is still desire for what we call they desire to have children, usually we won't start testosterone therapy. Yeah, all right. So, and of course, the last few slides is just want to debunk some misconceptions, you know. A lot of people, we know, we're very scared. I think like hormones, you know, when they talk about hormones, they say, oh, doctors, I think for female hormones, they'll talk about like breast cancer. Then for male hormones, they call it prostate cancer. But of course, from literature, search, these kind of things, and all the studies, we have shown that actually uh, testosterone replacement therapy, it doesn't cause prostate cancer. And in fact, you know, they find out that those that have prostate cancer in a high grade means that they are very active, not very active. We call it very high grade kind of things. Means that the prostate cancer is more aggressive one. They found is in the men that have lower testosterone. Yeah. So that is the thing that I think we need to convince people that, you know, and a lot of times, you know, when they put on testosterone, treatment, then they say I got prostate cancer. Actually, it's not because the prostate cancer maybe is there already. So of course, when you started to give some testosterone therapy, it will slightly stimulate it to grow a bit bigger. Okay, that's why one of the contraindication is that if you have prostate cancer, you cannot give testosterone at first. You need to cure it first. Then after cure it, you are clear of cancer, you can administer this testosterone. Yeah. So and another thing is they said, oh, testosterone cause heart problem, right? Heart disease. I think because of previous studies, as one studies that show that has increased in the heart disease. But of course, they have cleared that this is their data faulty, you know. But of course, when the news come out already, everyone becomes scared, you know. So, but after that, they are coming out with a big trial involving like 5,000 men, that tell that, they are equivalent list, that those taking testosterone and not taking testosterone, have equivalent list to have cardiovascular disease, to have a heart attack, these kind of things, right? And the last one is the testosterone, to make the prostate problem worse. You already have this. Yes, of course, if you have very bad kind of like what we call benign prostatic hyperplasia, then we will really like warn you, maybe you will get worsened. Yes, maybe at the initial stage. But there's some study actually say when you give testosterone actually improve after that. Yeah, so like you have this PPH is a relative contraindication, means that relatively we might want to consider not giving. So this one again we need to discuss with our healthcare professional. So as a summary, if you don't take anything that I've talked just now, it's okay. Maybe you just get back these few points, go back, then I think it's fine enough, right? So it causes variety of symptoms lah, and it's so strongly associated with comorbidities. And get it screened if you have symptoms, and of course you consult someone is professional for advice and treatment, right? And of course, gel and injection is what we commonly use, and testosterone therapy is safe, right? And the last is, again, normal, it doesn't equal to optimal, right? So with that, I thank you and I welcome questions. Thank you.
Thank you, Dr. Liao, for an insightful sharing. I guess I'm safe to say erectile dysfunction is the only problem that men may actually admit. They call it tired, but doctors will actually call it your hormones filing for early retirement. I'm just kidding. Just to summarize what Mr. Ho and Dr. Liao said, of course, erectile dysfunction, low testosterone level, it's a multifactorial problem. It may not just be aging alone. However, it is actually from the cellular level, so from the metabolic level. So my advice is to actually do a proper screening before taking any supplement, before actually taking or rather buying things online, to be safe. Understand your own body first. You need to improve your blood circulation. Then you can treat or repair the problem and rejuvenate the body.